Okay, so first up, a little bit about me. I am a mental health fellow at Healthy Minds Policy Initiative. I have a background in theater. I initially majored in theater in college, and then a few years ago made the switch to health and medicine. So I'll be starting medical school in the fall, and came to Health Themes by way of an interest in public policy and public health and incorporating that into my medical education and career. So that's a little bit about me. My focus at Healthy Minds is on integrated behavioral healthcare. So that is finding ways to improve the response to behavioral health concerns in primary care. So helping primary care practices and clinicians better identify people with mental health needs and treat them. So that's my main focus with Healthy Minds. But I'm also really interested in women's health, so that's this presentation today. So this slide is also me. I include this slide in this picture of myself for two reasons. First of all, to invite you all to see myself and this data as approachable. I hope if you have any questions that you'll feel comfortable just popping them into the chat or asking them, unmuting and asking them at the end. You're welcome to do that. We'll have some time for that. The second reason for this slide is just to give a plug for the Metriarch Data Lookbook. It's a really impressive collection of data and information about women's health in Oklahoma. So if you have an interest in that, I highly recommend you check out their lookbook. So again, if anyone has any questions during the presentation, feel free to pop those into the chat. Otherwise, we're going to keep on sliding here. So next up, I wanted to talk a little bit about Healthy Minds. Healthy Minds, the organization I work with, we are a team of policy and mental health experts and researchers who have an overall vision and mission of improving understanding of and outcomes for people with mental illness and substance use disorders in Oklahoma. We are a direct result of the Tulsa 10-year mental health plan. And so we are sort of the research and intellectual capital aspect of trying to make that plan come into action here and improve some of those outcomes for people in Oklahoma. These are some of the projects we're working on right now and the spheres we're working in. So I won't read all the way through this list, but feel free to take a look here. And if you have any questions about any of these spheres, I'm happy to answer them at the end. And then this one at the end here, that's my work right now. So to start us off, I wanted to do a little poll. So Gabby, if you could pull up the poll for all of us. It's anonymous, so feel free to answer honestly. It's a multiple choice option and you should see 2 questions there. So please just go ahead and fill that out. We'll see what our results are here. So let's see. Can everyone see the poll? Okay, good. Okay, Gabby, you just let me know when we've got all of our poll responses in here.
Yes, we've got about 75% of people who have voted.
Okay, cool. So we'll just give it a few more seconds here to go ahead and enter your responses in, and then we're going to keep moving on. So Gabby, you just let me know when you close that poll, and then you can throw those responses up on the screen for us.
Okay. All right, I'll give people about 5 more seconds. We've got about 86% of people voted, which is pretty good.
Okay.
All right, last call. All right, can you see the results?
Yes, I can see them. Can everybody see them? Okay, great. Okay, so if we look at these results, just from our little group here, we've got, let's see if I can do some quick math here. If we combine the several days, more than half the days, and nearly every day groups, we've got 85% of respondents have felt some level of anxiety symptoms over the last 7 days. And then we've got 45, 75, 85, also 85% of our respondents here have felt some level of depression symptoms over the last 7 days. So this is the COVID world that we're living in. I include this poll just because this is really similar to the polls that our data is pulled from here. So this gives us just a little bit of an idea of where we're all sitting with the same kind of questions that our poll respondents answered in this data that we look at. Okay, so you guys can go ahead and close your polls here, and we're going to move right along. First of all, to a pre-pandemic baseline. So I want everyone to think back to 2019, before COVID-19 happened, before the pandemic, before everything shut down. To give you a little context, the Game of Thrones finale that was extremely disappointing, that happened in 2019. We all met Baby Yoda in 2019. Old Town Road was 2019. The Jonas Brothers got back together. So it was a simpler time in 2019. And the data I'm about to show you gives us a little bit of a baseline with those same questions that you answered in that survey, of where we were sitting in terms of our anxiety and depression symptoms in 2019. So we've got about 22% of women, and this is overall in the United States. So this is not just Oklahoma women, this is in the entire United States. But we see, in terms of any symptoms, any severity whatsoever, which is similar to the poll you just took, we've got 22% of women reporting those symptoms versus 15% of men. And it's a similar number with anxiety here. We've got 19% of women reporting anxiety symptoms versus a little bit lower, 12% of men reporting those symptoms. And you can see sort of across the board with the different levels and severities of symptoms, women are experiencing more symptoms on average than men here. So before we get going into the 2020 data, I just want to give a couple of caveats on this information. First of all, I just want to acknowledge that the presentation is going to be pretty heavily gender binaried. We're discussing changes of symptoms in women and in men. So I just want to acknowledge that not everyone falls within one of these gender identity categories, and that we do lose the gender non-conforming population in this data, and that's just because of the way that the survey is set up. It's multiple choice questions, and there's only options to choose male or female. So anyone who is gender non-conforming who fills out this survey is going to be misrepresented in one of these two groups, or they're not going to include it in this data at all. So I just want to acknowledge that that is a limitation of this data, and recognize that that is a population of people that we do care about, and just hope for and continue to advocate for including all gender identities in future surveys. The Census Bureau did not ask me for my opinion about this, but if they ever do, I will be sure to advocate. And then the other important caveat is that we can't actually diagnose people based off of this survey. So we're not saying with this information, with this data, that more people have depression or more people have generalized anxiety disorder. We can't say that based on just a survey. That requires a clinician diagnosing. We also don't know how long these effects will last. It's very possible that some people are experiencing these anxiety or depression symptoms because of this extraordinary experience that we're all in. And when we go back to more of a quote unquote normal life, then those symptoms may recede. So we're not sure about the future of these symptoms, but that doesn't mean that this increased symptoms that people are feeling isn't worth addressing. So we're going to move now into 2020, and of course the COVID-19 pandemic. And I want you to give me a thumbs up. You can do it, with your real thumb, or you can do it with your reactions at the bottom of your Zoom screen here. Give me a thumbs up if you've seen any headlines or heard people talk about things like these. Yes, I'm seeing some thumbs up. I'm seeing lots of thumbs up. Yeah. So you've probably seen some of these headlines. You may have even dealt with some of these issues with yourself or loved ones close to you. We all sort of know that this pandemic has affected our mental health in some way. What we're going to do in this presentation is just give you a little bit more data that's supporting that. And then it identifies some possible causes, consequences, and resources for these symptoms. So similar to this headline here, the call volume for 211 surging 600%. Mental Health America also saw a 400% increase in online screenings from January to July here. So Mental Health America has these screening tools on its website. It's self-reporting. So you go on, you fill out the survey yourself, and then you can see, it will tell you if your responses align with mild, moderate, severe depression or no depression, if that's the screening that you took. So this basically gives us a sense that from January to July, people are noticing that they are experiencing some different symptoms, and more people are looking to some resources, trying to figure out what's going on. And importantly, a big majority of that group that are doing those screeners are female. Now, in terms of the bulk of the data we're going to look at here today, it's from what's called the Household Pulse Survey. So that's done by the Census Bureau and the National Center for Health Statistics. It's basically a weekly online survey that has a bunch of multiple choice questions that ask about how your life has been impacted by the COVID-19 pandemic. It started at the end of April, and it's actually continuing to this day, but for the purposes of this presentation, we stopped our data collection at the end of 2020. And within those bunch of questions that the survey asks, we are focusing in this presentation on those same questions that I polled you with at the beginning of this survey, asking about anxiety symptoms and depression symptoms. So, does anyone remember the percentage of women experiencing depression symptoms in 2019? If you remember, feel free to pop it into the chat box, unmute yourself, and tell us what that is. Would love to see if anybody remembers that. Let's see. Yes, Mercedes, good job, 22%. Okay, so let me get my screen back here. So we've got 22% of women reporting some level of depression symptoms last year. Now, my question for you now is, what are your guesses for that same number for 2020? What do you think what percentage of women in 2020 are reporting some level of depression symptoms? 70%, 66, 80, 60. Okay, you guys are actually really close. It's a little lower than that, which is great. 58% on average are experiencing some level of depression symptoms. And you can see the other significant thing about this data. So this goes week to week, what they're reporting. And it's the percentage of respondents. So we've got on average here, this averages out to about 58% of respondents over this period of time are reporting depression symptoms. And the other interesting thing about this is, other than this 1 week here, more women are reporting symptoms than men throughout this entire experience. So how about anxiety? Does anyone remember the average anxiety symptoms last year, the average percentage of women experiencing anxiety in 2019? Okay, good job, Haley. Yes, it's 19%. So with that, does anyone want to jump in and venture a guess as to 2020's anxiety symptoms? The percentage of women experiencing some level of anxiety symptoms in 2020. Okay, we've got a lot of high numbers. Ariel says 99.999%. You guys are all again in the ballpark. We've got 72% of women are experiencing some level of anxiety symptoms. And again, this includes those responses that are somewhere between several days, more than half the days, or nearly every day. You're experiencing anxiety symptoms. And again, with this graph, you see that more women are experiencing symptoms than men in this percentage of respondents here. So obviously this is not good, but I don't think any of us are hugely surprised, as evidenced by your pretty accurate guesses in the chat box, just because, the pandemic has brought a lot of extra stress to our lives. Some of the things that come to mind are, people are isolated, they're fearing illness and death in themselves or loved ones, they're experiencing unemployment or job instability. Maybe they're essential workers, so they have increased job responsibilities. A lot of people are balancing childcare and work. So there are a lot of things that we're dealing with right now that are increasing our stress and affecting our mental health. So I just want to translate these percentages here to numbers so you guys have an idea of the raw numbers that we're talking about. We have about 1.3 million Oklahoma women responding to this survey each week. That's the average. And then you look, these are our translations of our average depression symptoms and average anxiety symptoms. So on average, each week we have about 760,000 women reporting depression symptoms and 935,000 reporting anxiety symptoms. Now I included, just for reference here, the Oklahoma City and Tulsa populations combined. And if you look down here in this box, my little arrows are covering it, but 1 week we actually had more women reporting that they felt some level of anxiety symptoms than the entire Oklahoma City and Tulsa populations combined. So a lot of people in this state are reporting these symptoms and dealing with these symptoms. Now, if we think about why we may be experiencing some increased anxiety and depression, one of those big reasons that I mentioned just now is economic instability. So if we look at some economic stressors here, we know that women have accounted for 54% of overall job losses, even though we only make up 39% of global employment. And women's jobs are almost 2 times more vulnerable to job loss right now. So it's hitting us hard. And part of the reason that it's hitting us hard is the industries that we disproportionately work in. So if you think about, hospitality, tourism, retail are great examples. They're predominantly worked by women, and those are the industries that have been hit hardest by this COVID-19 pandemic. As you can see by these numbers of jobs shed, 7.7 million from leisure and hospitality. Now, this isn't just women, this includes all employees, but since we know that these industries are disproportionately worked by women, we know that that helps to account for this unemployment rate and that it is affecting women, and particularly women of color, more severely. So now if we go into some data breakdowns, we broke down the data in a few different ways to try to get a little bit more insight into how COVID-19 is affecting different demographics within the Oklahoma women's population. And how it's affecting their mental health differently. So we broke the data down by race and ethnicity, by the number of people in the household, and by generation. So we're going to start with race and ethnicity here. Now, I know this graph is pretty confusing. It looks a little bit like this beloved 90s novelty toy. So just bear with me if it's a little confusing, because we're gonna work through it here. So at the top, you have several different racial and ethnic identities included here. And at the end of the chart, I've included the totals. So that's all the weeks added up together and then broken into a percentage, and the averages for each week. So if you look at this total and this averages section, you see that all of these racial and ethnic identities are actually on average experiencing close to the same level of depression symptoms here. Where the difference comes in is the volatility from week to week. So I pulled out the line for white women and Black women so we could see that broken down a little bit. But if you look here at the line for white women in Oklahoma, there's not a lot of change from week to week. It's pretty steady. Whereas if you look at the line for Black women in Oklahoma, there are some really high highs in here, some lower lows, and just overall, there's a lot more change from week to week. The same is true for anxiety. And with anxiety, we have on average, everybody's symptoms are a little bit higher. So if you compare these two graphs, you see with the depression graph, we're all sort of hovering around 50, 60, 70%. Whereas with the anxiety graph, we're all a little bit higher in that 60 to 70 to 80% range. And again, I pulled out white women versus Asian women in Oklahoma. And you can see again, the line for white women is pretty consistent throughout this time period, whereas we have a lot more volatility in this line for Asian women in Oklahoma. Now, when we think about some of the things that could be causing this volatility, I think there are a lot of factors to consider. Important places to start are the disproportionate infection and death rates in these communities of color. You see an example here with Black Americans. They only make up about 14% of the population, but they're making up about 27% of COVID-19 infections. And we know that they're also dying at nearly 2.5 times the rate of white people in the United States. So that could account for some of those higher highs, that extra stress, as well as some disproportionate job loss. We know that 49% of the Latinx population have said that they or someone in their household has had to either take a pay cut or lost their job due to COVID-19, compared to only 33% here of the general US adult population. We also know that communities of color often make up a disproportionate amount of frontline workers and essential workers. So that added stress on those communities could contribute to some of those higher highs from week to week as well. In thinking about why some of these communities of color may have experienced some lower lows, I think there's a few possibilities to think about. The first of which is data collection. We know that when you're collecting data on a smaller population, the extremes of that population or changes in responses from week to week are going to have a bigger effect on the data and skew the data more significantly from week to week. So part of that might just be due to the fact that some of these populations are smaller. Another thing to think about is distrust of the medical community and the government. An example of this is there was a headline in February about the Office of Refugee Resettlement was sharing immigrant youth's psychotherapy notes with ICE in order to deny them asylum based on their mental health problems. So if I were someone in a community that is affected by that, and I saw those headlines, I might understandably underreport my symptoms to a survey like this. I think also stigma might have an impact when you think about, in any community, when you have misunderstanding or stigma around mental health issues and mental illness, it makes sense that people might struggle to admit their own symptoms to themselves, to others, or on a survey. And then finally, we know that systemic racism is a problem. It's a problem in the medical community as well. And we know that people of color are often underdiagnosed and undertreated for medical issues, and mental health is affected by that as well. So if you go to your doctor and you're told that you don't have these medical or these mental health problems that you think you have, or that this is not really a problem, then it's understandable to think that perhaps that might affect the way that you think about your own symptoms and affect the way that you would respond to a survey like this. So next, we're going to break down the data by the number of people in the household. Now, this, again, the averages are all really close together. So we've broken it down by a single person. So that would be the woman responding to the survey who lives alone. We've got small families of 2 to 4 people, and then we have large families of 5 to 10 people. And they all average pretty close together, but you do see some higher highs coming from this single person household. And I think it's interesting that these occur, especially early on in the pandemic, in May, June, and July, which makes sense to me as people are adjusting to the isolation of living alone. The same thing happens with anxiety symptoms. Again, our averages are pretty close together, but for both the single person and the large family, you've got a lot of volatility from week to week. I also think it's interesting that this volatility pops back up around the holidays for the large family, and stays pretty high in these weeks as we're going back to school. So I don't have any sort of proof of this, but I wonder if part of that has to do with the fact that they are dealing with some virtual learning in their household. So virtual learning and childcare fall under the category of unpaid care. And I think that's a big and important aspect to think about when we talk about how women are being affected by this pandemic. So we know and have known for a long time that unpaid care disproportionately falls to women. And unpaid care really means all of the things that you do, the services that you provide to keep your household running from day to day that you don't get paid for. So any sort of caring for children, caring for sick family members, cooking, cleaning, any of that falls into this category. So long before the pandemic, this has disproportionately fallen to women. And it's the COVID-19 pandemic has, again, sort of exacerbated this, as we can see in these statistics showing that 1 in 3 women not working are not doing so because of childcare needs versus 1 in 8 men. And a quick caveat that this is a specific age group of women. This is women aged 25 to 44 years old and men aged 25 to 44 years old. So this is in that sort of child raising age range. We're seeing a lot more women needing to stay home and take care of kids than men. And when people are able to go back to work, so even if they lost their job early on or were furloughed, we're finding that that decision is really difficult for women because of these unpaid care responsibilities. So when faced with this opportunity to go back to work, there's a lot more balancing and questioning that women are doing than men. And this has a lot of people worried about potential consequences in the long run as we see women drop out of the workforce and not return to it, even when they're given an opportunity. And people are particularly worried about this in terms of sort of backpedaling on the advancements we've made in gender equality in the workplace in recent years, equal pay. I think all of those things are at risk if we don't try to find some ways to help support women in returning to the workforce if they do want to do so. So next up is generations, breaking down the data by generations. Now, I think this one is really fascinating because it shows it's a really clear breakdown from generation to generation. You have our oldest generation, the silent generation, all the way at the bottom here with the lowest percentage of women reporting symptoms. And this works up by generations. We've got the baby boomers here with the next lowest rate of symptoms. And then we have our Gen X and Millennials sort of vying for this middle area here, with our Gen Zers showing the highest percentage of women with depression symptoms. And the same is true for anxiety symptoms. Again, we've got the anxiety symptoms, the percentage is bumped up a little higher than the depression symptoms for everyone. But again, you have this pretty nice breakdown of the different generations with heightening, with an increased percentage of women showing symptoms as you go down to the younger generations. So here's those averages compared to each other. So again, you can just see how the symptom load is increasing on Gen Z. We've got more Gen Z women experiencing symptoms than the silent generation. And some possible explanations for this. I think, when you think about Gen Z, those are our 8-year-olds to our 21-year-olds. So that's the school-aged individuals in our population. And I think it's fair to argue that in many ways, their lives have been the most upset and altered by this COVID-19 pandemic, partially because so much of their lives revolve around school and rely on that for their social network. Many people also rely on school for meals and for social supports, for mental health resources, for role models. And they are, in some ways, the least in control of their situation of the generations. And so I think that both of those things can really contribute to their increased anxiety and depression symptoms, as well as the fact that they are at the most critical time in their lives for social development. Then I think Millennials and Gen X being pretty close together and with higher percentage of symptoms than Boomers and Silent generation makes sense because this is the bulk of our workforce here. So they are being most affected by the economic uncertainty, the job loss, as well as any of those unpaid care responsibilities that we talked about earlier. Whereas our baby boomers and the silent generation are nearing retirement or in retirement. So they have a little bit less of that stress. They might be more secure in their job. But I also think that it's important to think about the possibility of underreporting or not recognizing symptoms in some of these older generations in a survey like this. I think it's much more common for these younger generations to talk about and acknowledge their own symptoms of anxiety or depression versus someone in one of these older generations, like the boomers or the silent generation, might not have that language to talk about that, or might not recognize that in themselves, or might not feel comfortable acknowledging or admitting that on a survey. So these are all of our demographic breakdowns. Now, when you think back, all the way back to those 2019 stats, with 22% of women experiencing depression and 19% of women experiencing anxiety, you can see the really significant toll that COVID-19 has taken on our mental health as a population. And I think it's important to think about some of the consequences of these changes in our the symptoms that we're experiencing and in our mental health, and prepare for those things and think about them. So these are our projections for the Oklahoma population overall. So this is not specific to women. This has also not happened yet necessarily. Or if it has, we haven't been able to collect this data. These are just projections that Healthy Minds put out in April of 2020. So when we think about suicide, we know that unemployment can have a big impact on mental health. If you think back to the Great Recession, we know that from 2007 to 2009, there was a 13% increase in suicides due to unemployment during that time. And that in 2009, we had 46,000 suicides associated with unemployment. So unemployment alone can have a big impact on suicide rates in the United States. And then when you add all of the other things that COVID-19 has stressed our lives with, like that fear of sickness, losing loved ones, all of those other things that we're thinking about, you can understand why we're worried about some increasing suicide rates. The same is true for drug and alcohol use. We know that when people struggle with mental health and don't have many resources or options available to them, they often turn to self-medicating with with alcohol or some of these other illegal substances. And especially right now, when people are nervous to go to a doctor's office or to be out in public, it makes sense that people are turning more to these substances to self-medicate. But obviously, that's not what we want in terms of treating your mental health problems. And then when you think about this last statistic or this last projection, um, this is obviously concerning because this is a huge increase in mental health issues due to increased ACEs, adverse childhood experiences. But this is especially concerning for Oklahoma because we are already so high in ACEs, in adverse childhood experiences. So Oklahoma is already #1 in the country for ACEs. So the possibility of this increasing even more, especially a 94% increase, is really scary and concerning. A few more potential consequences here. If we're moving from projections to consequences, now we don't have the data necessarily yet to say, based on these projections, whether they've happened or not. For suicide, for example, there's like one study so far out of Massachusetts that indicates that there hasn't been a significant increase in suicides in the early months of the pandemic, which is hopeful, but that's only one study, and that's out of Massachusetts. So it's really preliminary. We don't know how the suicide rates will change. However, we do know that 1 in 4 young adults are having thoughts about suicide during COVID-19. So there's still a lot of reason to keep an eye on this and to keep track of it. Now, I mentioned earlier that with women dropping out of the workforce, there's a risk of setting ourselves back in terms of gender equality in the workplace. And that is definitely true. But what is also true is that there's risk of economic loss. This projection from McKinsey shows that we could lose potentially $1 trillion from the global GDP by 2030 if we don't take any action to counter these effects of women dropping out of the workforce. And that's a big loss. We don't want to do that. We don't want to lose women out of the workforce, both because we don't want to lose those advances and because we want to continue to grow our resources here. And then lastly, we are seeing an increase in women's heavy drinking. We're also seeing an increase in general alcohol consumption for women. So that is increasing by 17%. We've also seen alcohol sales rise. In March alone, they rose 54%. I think we all saw headlines early on about how much alcohol sales were rising. And while those headlines were sort of funny at first, I think it is really important to take that seriously and recognize that it is a concerning issue because it means that it's indicative of people using these substances to attempt to cope with their isolation and their mental health and these difficult experiences. And that's not what we want. So the next question probably that you're all thinking is, so what do we do about this? We have all this data. We know the potential consequences. What do we do about it? Now, it's not lost on me that I am sharing some pretty depressing statistics about women in Oklahoma with women in Oklahoma, many of whom may be the women in Oklahoma experiencing these symptoms. So I apologize if this presentation has contributed at all to your stress, your anxiety or depression. But I think, what excites me and what gets me hopeful about this is that things like this conference are happening around Oklahoma. We're talking about these mental health issues. We're talking about the effects of the pandemic and what to do about it. And that is how we make change. So in thinking on a clinical level, what do we do? One option, and this is a plug for myself and my work, is integrated care. So we know that we have a shortage of psychiatrists in Oklahoma. But we also have a higher than average number of primary care providers. So as we're thinking about the ways in which this percentage of people with symptoms is increasing, if we rely solely on the current system for mental health as it is, it's going to further strain an already overwhelmed workforce. So we need to think about some alternative options to expand our clinician base here. And primary care providers are a great option for that, because not only are they capable to manage most all mental health concerns, other than really severe cases or really complicated cases in which you would need a specialist, a psychiatrist. They also are seeing a lot more patients than those behavioral health specialists are. So many people with, who are struggling with mental health or substance use conditions, they might not seek out support or services for those conditions, but they are pretty likely to visit their primary care provider in a given year. So integrated care basically suggests that we screen every single patient that walks through the door of a primary care practice for these common mental health conditions and substance use disorders. And that way we're capturing even the people who don't bring it up to their primary care providers, but who have shown up at the door. And then improving and supporting the training for primary care providers to provide evidence-based treatment for these mental health conditions and substance use disorders. So if we sort of expand the capability of our primary care practices, that's a great opportunity for us to potentially meet this need. In thinking beyond a clinical setting, I think we can think about how we can support and care for each other with some non-clinical options, because I really want to challenge the idea that support and treatment for these conditions only happens in a clinic. That is an important part of recovery and treatment, but community and social support is also a huge factor in recovery and in treatment for mental illness and substance use. So, and especially right now, as we are in this context of, limited access to our health resources, maybe, I think this is a great time for us to really bulk up our community support options. So there are a lot of different ways that you can help support and care for your community. If you own a business, you are in a position of power and authority, and you can make changes to empower and support your employees with mental health conditions. You can make your workplace a less stigmatizing and more welcoming place for those people, just by making some basic changes, and by looking into how your insurance plan covers mental health, for example. We also know that there are a ton of other factors that play into mental illness and health overall. So these are called social determinants of health, and there are many other ways to support and volunteer and care for your community besides specifically doing so in a way that affects mental health. An example of that is delivering prescriptions or volunteering at the food bank, because we know that it's really hard to focus on going to the doctor and refilling your prescription if you're in fear of being evicted from your home, or if you don't know where your next meal is coming from. So providing support for any of those sorts of problems and issues in the community is going to support mental health for your community. And then also, if you don't feel safe volunteering at the food bank right now, which is understandable, I think you can start with your own community and reach out to your family and your friends, and be a support for your own social network, in terms of making sure that they know that you are a resource for them. These are some of the things that have really helped me in this pandemic. And so I would just encourage you to think about some of the ways that you have been able to help your community and your friends and your family, and how you can continue to do that even in these months moving forward. And then this slide is just some more options in terms of supporting yourself. I think we hear a lot about wellness and self-care, and that is sort of a big industry right now. And that is great. It's great that we talk about this a lot, and that it has gotten a lot of sort of airtime, but I think it's important to remember that wellness and self-care may not look like doing yoga and taking a bubble bath for everyone. So the key is finding the things that really help you sort of calm down and breathe and relax when you're having a hard day. Help and just the resources that you know that you can always turn to support yourself. And I just really want to highlight this idea of resilience because that is what we're all building right now, resilience to get through difficult times and adapt to different situations and sort of scary and uncertain times. So, and important to remember that resilience isn't just sort of a, atmosphere or a vibe or a thing that you just are, but it's the tools that you have, it's the resources that you connect to, it's the ways that you act and reach out when you need help, so that next time that happens, you know that you have all of these tools and that you have these resources that you can reach out to. And of course, I just want to mention and highlight that none of this is meant to replace mental health care. So if you do need support, if you do need some mental health resources, or need to speak to a professional, there are a lot of options for you. And I've highlighted a few of them here, and I would encourage you to just check those out if you need them. So I hope it is just abundantly clear to everybody from this presentation that if you are feeling any of these symptoms, you are not alone. There are a lot of other people experiencing this with you. And that is because we are going through a really difficult time right now that none of us have experienced before. And it's pushing us to our collective breaking point, but I hope that you know that you have all of these resources and you are building resilience and building these tools to help yourself get through this. And I would just encourage all of you and all of us to continue to take note of those things that you do that make you feel better, and continue to reach out to your community, because we can all be there for each other as we're going through this. So yeah, you have the resilience to get through this, and I know that we can all learn from this experience and come out stronger on the other end. So that is the end of my presentation. Thank you all so much for listening. I'm gonna turn it over to Gabby now to see if we have any questions and go ahead and close out this slideshow here.